For this video, I will be doing the Froments, the grip strength, and the Jepson-Taylor test for the hand. So first for Froments, this is testing the median nerve. So you get the patient to grip onto the card with the tips of the thumb and the index finger. And then the clinician will pull the card and see how strong it is. If the patient, the pads of the fingers go down, that is a median nerve issue. Next, I'll be doing the grip strength. So get the patient to do this. Two hands, you do. So you're gonna do that to me, all right? So what you're doing with this is to test bilaterally how strong the grip is to see if there's any differences bilaterally between the grip. All right, you can relax. Next is Jepson-Taylor. This is a set of tests for hand function. So we'll start off with writing. So the patient is going to write his name and see how his fingers and hand function as he writes his name. Good. Next is simulated eating. So patient will act as if they're eating, see if there's proper hand function. Relax. Next is stacking blocks. So you're gonna stack them right on top of each other. Good. Also, going to be flipping over cards. So just right on top of each other. All right, good. And the last part is picking up small objects, picking up large objects, and also picking up large and heavy objects.
Okay, so today we're going to be going through the hand function test, Finkelstein, Buntle-Littler, Murphy-Sign, and Sweater finger. For the first one, we're going to do Buntle-Littler, which is testing for contracture in the joint capsule. Well, what I'm going to have Hunter do is I'm going to put him into metacarpal pharyngeal joint extension, and then I'm going to passively flex his PIP joint. If he's unable to flex his PIP joint, then that narrows it down to an intrinsic hand muscle issue or a contracture of the joint capsule. And if we flex his MP joint and do the same test again and he is unable to flex his PIP joint, then that indicates an intrinsic hand muscle issue. And for the next test, we're going to do Murphy sign, which is where you have the patient make a fist and you look for equal arches across the metacarpal heads, which he has, and this is to test for Boxer fracture or metacarpal fractures. And if the third metacarpal is out of line, it can indicate a lunate dislocation. For the next test, we're going to do sweater finger. You're going to have your patient hold their hands up in a fist. And what you're looking for is for one finger's distal phalanx not to flex, which would indicate a flexor tendon issue, which would most likely be jersey finger. Next one we're going to do is Finkelstein's, which tests for Dekkervain's tendinitis, which is tendinitis of the muscles in the first dorsal compartment. So what you're going to do is have the patient make a fist with their thumb wrapped inside their fingers. Then you're going to passively ulnar deviate. And if you feel crepitus and pain, then they're positive for tendinitis of the first dorsal compartment. And then for the hand function test, what you're going to do is just have your patient open and close their hands, relax, do some dexterity movements. And you're looking for just normal function of the fingers. And then when you have them relax, you're looking to make sure they're not straight out with their hands, because that could indicate guarding of an injury, or if they're completely clenched on one side and they're relaxed on the other. That could indicate another issue.